Hey everybody, it's Dr. Eric Balcavage. We're back for another edition of the Thyroid Answers podcast. And today we have a returning guest, Lacey Dunn. She's a functional medicine dietitian. Did I get that right? I hope I did, right?
Dietitian, yes. Dietitian with a T.
With a T. You know what? Every dietitian that I've talked to says the same thing. So that must be a common thing that somebody spells that wrong. And I'd probably be one of those people who spelled it wrong, by the way. But you're back. I appreciate you coming back on, but there's a reason. Not only are you a wealth of information, but there's another reason we brought you back, and that is that you recently released or published your new book. So we want to talk quite a bit about the book. But before we get into that, A, congratulations, and B, for people who maybe don't know who you are, and I don't know how that's possible with all the people that follow you all over the place, right? Give some people a little bit background of who Lacey Dunn is and how she got into this functional medicine space from maybe a traditional dietitian role.
Well, thank you so much for the warm welcome and having me back on. This really is an honor because you already know I'm a big fan of you. And I'm really excited. I put a lot of effort and a lot of love. This is my labor of love here, the Women's Guide to Hormonal Harmony, which is my book. And honestly, with creating the book, I made it as a resource and a quote unquote Bible for women to truly understand their bodies, their hormones, and be able to be the master of their own bodies and understand this is how my hormones in my body works. And this is why my body responds this way when something goes wrong. And this is how I can help it. So it's a resource and a tool for women. Now,
go ahead.
I was going to say, when it comes down to why I'm in functional medicine, well, that's because I've gone through my own trials and tribulations and struggles as well. I used to be, and I'm finally back to it after my own struggles, but I used to be a bodybuilder and a pretty good bodybuilder. And I, all of a sudden, with doing my master's degree and my dietetic and internship and doing virtual training online, I was burning down into the ground and I didn't realize it. I was just trying to get through my day. And now when I talk to clients, I call that boss bitch mode. You're just trying to get through your day and you don't realize that you're gonna hit a wall soon. And I suddenly all of a sudden started, and I didn't notice it at first, I started gaining weight. My hair was falling out. I was cold all the time. I had gastrointestinal distress with bloating. My eyebrows were falling out and I was chronically fatigued and had a lot of anxiety. And we were learning about the thyroid and iodine and zinc and all these nutrients in my master's course. And I'm always the person that tries to go above and beyond what I'm learning. So I went out and I found a book to talk more about the thyroid, to better understand the thyroid. And I was reading through Aviva Romm's Adrenal Thyroid Revolution, which is one of the best thyroid books, minus when yours comes out. One of the best books that you could read for your adrenals and your thyroid. And I was like, holy crap, this is me. And I asked my doctor to do some tests and he wouldn't. So I did them myself and I found out I was truly hypothyroidism. And there's a long story with that, with trying different medications, them not working and not understanding why they were not working. And finally, I figured it all myself. It was my adrenals and it was my gut. And then, of course, there's a long-winded history from this past year, what I've dealt with, but that was essentially how I got started in functional medicine. I figured out, okay, the conventional world is truly dismissing patients, especially thyroid and sex hormone imbalance patients. And there is a reason why people don't feel well. People are not getting the full picture here with their labs and their history and their symptoms, and they're not getting treated the way that they should.
Yeah, and I think that's a really important point. And I think one of the challenges is what the role of allopathic medicine is, right? And so I came from that world. And so because was kind of indoctrinated in a certain way of thinking, right? And then when I had my health issues and got kind of disenchanted with that model, I went to chiropractic school and then get functional medicine training. And, it becomes this odyssey. And early on, and I'm sure you kind of went through this too, I was more angry. Like, why is it that this group of really smart people aren't doing something different? Some of these things seemed obvious, right? When you look at, when you start to get trained in functional medicine. And I was angry. I was really angry in the beginning that why aren't you running a full thyroid panel? Like, if these tests are all available, why wouldn't you do it? And I was even, early on in writing stuff, even for the book, for my book, it was an angry book, right? And then in the last few years, and maybe that's been the benefit of having this whole project delayed for a number of years, is I've really softened my tone, because I don't think overall that medical physicians are trying to hurt somebody or harm somebody or just not do things, right? They're trained in a certain way, and there's certain guidelines that they need to follow, and they're following the guidelines and doing what's been taught to them and what an insurance company or a set of guidelines says to do. And to go outside of that model, they don't even know that there's a model outside the model they're in many times. And two, if they go outside that model, they get in trouble, right? To some degree, right? It's funny. I had a podcast with a medical physician, and he did, and one of the things he said that was funny was he's like, I did not even know there was this parallel universe of functional medicine, right? It was never taught to him. It never occurred to him. And how would you know, right? You're busy doing your job. You're doing what you've been trained to do. And, part of the reason I had him on the podcast because he was a client and he was struggling with the same issues his patients were having, and his model wasn't working for him, right? So, he's frustrated and found this functional medicine universe, right? This altered universe, accidentally. And then, I really, through that, I really started to say, hey, I shouldn't be angry at the people. I should be really concerned about the philosophy of how they treat. But even now I look at that and go, good, we need that group to do acute care, to do emergency care, right? To manage those who don't want to take control and try and get to the root cause issues. And that leaves a place for you, for me, which is this functional medicine approach. So I think we all kind of grow and mature. I think sometimes some of my family might say I haven't matured yet, but as we mature, we start to say, okay, we got to find a place and a way to connect all of us together so that we can help ourselves and our clients the best. We need to make sure we have crisis care and medical management for those who really want that approach. And then we want to be able to have people learn about functional medicine so that way they can have an alternative approach to just trying to take a bunch of medications.
I fully agree. I was in that same boat. It's a roadmap that they're following. And in the time when it happens to you, it doesn't make sense and it makes you angry. But when you take a step back and you realize, okay, they truly are trying to help and they're going based off of what they know and what they were taught, it makes sense. So the one thing I would say is there are some doctors that become too rigid in that, in which even when they're told and they're told about functional medicine and the ifs and the whys, they don't budge. That's a whole nother issue. That's black or white thinking and dismissing new science. But I'm the same way. I'm not as hardened as I was.
Yeah. So, and even when clients go to, even for you, like you go to your endocrinologist, right? And say, hey, I've got this issue. And if they're doing the conventional treatment or following the conventional guidelines, and you're asking for a test that they don't know, they're not really sure what to do with it, right? Insurance company may not cover it. And now they're responsible for it. Why would I run it? It doesn't play a role in their diagnosis of a disorder, and it doesn't play a role in their guidelines of treatment, right?
Yeah. For example, thyroid antibodies. It's like pulling teeth to try and get an antibody.
Yeah. And part of that is because I think the general consensus is that the vast majority of people with hypothyroidism, it's immune driven. So why do I need to run antibodies, right? Because in that model, antibodies don't matter. What matters is I have an immune condition that's destroying a thyroid gland. And this is a person who is, by the time they're primary hypothyroidism, they've lost 90% of the function of the gland. They're going to need thyroid hormone medication anyway. And we don't have an immune-based protocol to address thyroid antibodies, right? There is no established protocol for addressing it. The vast majority of physicians aren't going to put somebody on immune suppressants because they have a thyroid disorder. And the thought process is it's the immune system's only attacking the thyroid gland. So it's going to get destroyed anyway. It can't come back
That's
on
so
its own,
sad.
right? But that it is sad, but I think for our clients, our patients, it's important for them to know that when a medical physician, you ask them to run a free T3, a reverse T3, thyroid antibodies, and they go, no, the reason isn't because they're just mean-spirited, and most times, right? But most times they are, hey, insurance companies might give me a hard time for running it. Now I'm responsible for lab tests that I don't even know what to do with it. And I think one of the reasons things like T3 and reverse T3 don't get run because when we provide a T4 only treatment, and to some degree T3 treatment, but I'd say for T4 only treatment for now, the more T4 treatment we give and the lower TSH goes, oftentimes free T3, right, goes down, not up, until you excessively provide like way too much T4, and reverse T3 goes up in a lot of clients. And early on, they tried to use those markers, but I don't think it made sense. Like, we're giving them T4, but their reverse T3 is going up, but they still have symptoms. So we'll just throw this out. We're just not going to look at it, right? Same thing for free T3. Let's just get rid of it. Let's simplify this. Let's bring it back down to a TSH and a free T4. Those are things we can control, and everything else was kind of thrown out. Like, we're not going to look at it. It's sad, but that's the model. What's being treated in thyroid world is we're trying to provide enough T4 to restore a TSH, end of story. That's it. And nothing else seems to be looked at or mattered. And I think it's just because nobody cared, or not that nobody cared, but it wasn't being figured out what was really going on, because oftentimes in medicine, and we'll talk about that with other hormones as well, is that we want a simple protocol to treat a symptom or manage symptoms and manage a disease. And the easiest way to manage a thyroid condition, which is all we're really doing with T4, is to monitor two numbers, free T4 and free T6. I've done the job. I've restored TSH. That's considered euthyroidism. And if you don't look at anything else, you don't have to manage anything else. And that's where people get really frustrated because, hey, I'm still have hypothyroid symptoms despite this, or I have hyper and hypothyroid symptoms, even though my TSH is normalized. I don't feel better. But it's easier to hang your hat on, I fixed something, right? TSH is back to normal, right? So let's talk about hormones. You talked about why you wrote the book, to give a guideline, to give this to be a guidebook for people to understand the hormones, especially women, because it's right in the title, right? So why do you think it was needed? Like, now I have an answer, but you work with a lot of female clients. You're female. I work with a lot of female clients. But why do you think there's this need for people to have a better understanding of what's going on with their hormones?
I was talking to client after client and people in my everyday life, and nobody understood how their hormones even worked. They didn't even understand what it was to even have a normal cycle, what a normal cycle looked like. And so many women kept telling me that they didn't even understand why or how birth control worked and how they could even get pregnant. And they didn't understand this is why, or what happens when I don't get a period, or have a late period, or have an early period. And the symptoms that people were willing to deal with was just blowing my mind. And I was like, people need to understand this is why they're feeling the way that they're feeling, and this is what they can do to help. And this is why this is occurring. So I want women to understand their bodies, to understand what's happening on a physiological level, because that is foundation for knowledge. And that's foundation for being able to adjust your diet, your lifestyle, your supplementation, and figure out what is the cause of that hormonal issue, instead of just like blanket throwing a birth control when somebody has heavy PMS or painful periods, or just throwing Clomid at somebody who is not able to have a consistent and has an irregular period. So my goal is knowledge and education, and of course, encouragement in the process.
Yeah. Do you think that there's a couple of issues that probably have led to that, right? Because I see the same thing, you know, when you ask somebody about their menstrual cycle, they're like, they're not, we had kind of say, okay, here's when it starts, here's when it ends. And when I have that conversation with people, they're like, when does it start? Like, what's the start? What's considered the start point? What's normal? How long should it be? What's a heavy cycle? What's normal? What's not normal?
It's not talked about because it's gross because, well, it's not gross, but women are taught our periods are gross. So we're taught not to talk about it too. So that's a whole different issue. Yeah. And especially medical gaslighting that occurs. But yeah.
So I think that's a big piece of it, right? It's easier to not have a discussion and kind of pat people on the head and say, that's just the way it is, and be quiet, right? Mm-hmm. And I think that's a big problem, especially I think overall in women's healthcare, because initially it was driven by a bunch of men who don't have menstrual cycles, right? And so, we don't have maybe that same understanding that a woman might have had and now that we see more women in healthcare saying, hey, this is not normal. This is how things should be addressed. And I agree. I don't think there's a great educational process to help women understand, what a cycle's supposed to be like, what these secretions are supposed to mean, what changes in their physiology are supposed to mean, what's normal, what's not normal. And probably because we're doing it, seventh grade, we teach it when kids are like, especially women are probably just mortified that they're now bleeding, right?
Right.
And more concerned about like their pimples and other things and trying to, how do I hide this process? And they're not really into the science of how their body works. They're just trying to get through a health class, right? Mm-hmm. So I think having more resources for people to understand what's normal, what's not normal is a really important thing. And probably the other thing that is that, we've all been medically indoctrinated that signs and symptoms are the problem. And all we need to do is suppress them, and the solution's gone, or the problem's gone, right? And we fixed it, right? If you have an abnormal cycle, we put you on birth control, and now you bleed, you have an organized bleeding cycle, everything's good, right? Meanwhile, and I think sometimes we don't let people know that every system relates to the others, right? And that, you just had a hormone issue. Okay. And that might be more allopathic training, but we know in functional medicine that it's rare that you just have an androgen issue or an estrogen issue without having an immune issue and a thyroid issue and a blood sugar regulation issue. So what do you see as the primary issues impacting women's health? We'll talk about women's health overall and then hormone regulation in a second. So what do you see as the biggest challenges for most women regarding their overall health and well-being?
I see a lot of low progesterone, honestly. And whether that creates heavy, painful periods, bloating, bad PMS, heavy bleeding, or that happens to create irregular cycles or a loss of a cycle. That's what I see a lot. And it's transitioned over time, especially with COVID. I was seeing previously a lot of issues when it came down to the painful, heavy periods. And now that's transitioned to very much irregular periods. And that's really tied to an immune system, a dysregulated immune system, and nutrient deficiencies and gut infections secondary to COVID. And there's so many issues, but that's what I see for the most part is lack of progesterone. And for the most part, when we're talking about progesterone being created, that's only created after you ovulate. So that tells me women are not ovulating. And to simplify it as much as possible, the body thinks there's some shape or form of internal or external tiger here. And it's saying, yeah, no, this is not a safe time for me to have a baby. And it's preserving the body. And as much as the symptoms suck, the symptoms are actually the body trying to preserve you and preserve a future baby, right?
Yeah.
And so you got to listen to them.
Yeah. So I love that, because I always look at things through the lens of the cell danger response, right? So I always tell people that cells operate in one of two modes. They're either in low stress manufacturing mode, they're making hormones and enzymes and proteins and burning it and making lots of energy, burning fat, making hair, making skin, making nails, like they're in manufacturing mode. And in that situation, they're typically their cells that are in a higher T3 state, because the T3 is the thing that turns on the manufacturing process and turns off the cell danger response. But when cells perceive danger, they're not going to make more protein. They're not bringing more glucose into a cell. They're not bringing more resources into a cell that may have a latent organism, like a latent infection inside it. Why would you want to bring more resources into a cell that may have an infection inside it? That would just help the organism grow, right? Mm-hmm. And so when we see problems with hormone regulation, thyroid regulation, blood sugar regulation, gaining body fat, right? I try and get my clients to understand you're not in homeostasis. You're in allostasis. Your cells are operating from a state of danger. They're in threatened mode. They're being chased by the proverbial tiger, right? And so they're not broken, at least early on. They're adapting, right? My world has changed. Before I was manufacturing, I can't put time and energy towards manufacturing because that'll support the threat. And I need to put more energy towards ramping up the immune and inflammatory process, right? Would you agree with those ideas?
Oh, 100%. I call it the zombie apocalypse mode. Mm-hmm. The body's like, oh, the zombie, like, let me preserve myself.
And we look at the immune system sometimes, we go, oh, the immune system's just dysregulated, right? It's just lost control. Like you woke up today and your immune system decided, no, I'm going to start just destroying the thyroid gland. I don't like it anymore. I just want to get rid of it, right? I just don't look at the immune system necessarily as this just totally dysfunctional system. I look at it, I think like you do, and that is, if you've got immune-related disorders going on, you got to start asking better questions like, why is the mm-hmm. cell, why is the immune system trying to protect itself?
You're the same way as me. It's the why behind the why behind the why. We're digging deeper and we're peeling away that orange. We're trying to get into all the different layers here.
Mm-hmm. So the problem, right, is that the medical model pays maybe less attention to that. And in the functional medicine model, we should be paying attention to. I don't know that that's always happening in functional medicine, but that's what we should be doing. So where do you see when a client comes from an allopathic, everybody came from an allopathic upbringing, right? And an allopathic philosophy, like you got heartburn, you take this, you got reflux, you take that, you got constipation, you take this, you do this, you take that, you have an abnormal cycle, you take this, you have thyroid problem, you just take hormone. How do you get that person who's coming with a philosophy of diagnosis, simple solution, move on, right? To no, we got a lot of work to do because we got to try and uncover the root cause issues here.
That's the hardest thing to do, honestly, because people get stuck in that black or white thinking, right? And they're like, no, but I just want you to give me XYZ plan so I can fix XYZ. And it's like, no, there's a lot of work we have to do here. Your body has adapted and there's a lot of physiological, like syndromes and different organs that have been impacted that we have to adjust here. And I think that's the hardest when people come from more of an under eating, over exercising state, or when they come from a lot of gut infections and a lot of antibiotics, and their body has significantly adapted to the point where now it's going to take more than just that. It's going to take every single bit of diet, lifestyle, supplementation, all these different adjustments to get their body back to the healthier place. And it takes a lot of retraining the brain and talking it through and making people understand that it still matters what you did in the past that's affecting your now. We can't forget about that either.
Yeah. And for the the patient or the client that's maybe listening, like that's why to me, and I'm sure to you, Lacey, that somebody's health timeline is like so important because it tells the story of how we got to where we are, right? And
it can be very helpful for them understanding, okay, this is why I have to do what I'm doing now. This is why I have to make these changes.
Right. Because you can go back and look at somebody like, all right, look, you had early chronic infections, right? And then you took a bunch of antibiotics, and then you started to have more allergies, and then you had chronic tonsillitis. So they took out your tonsils, and then that fixed that. And then you started to have abnormal cycles. And so then you were on birth control. And then you start to see this pattern of stuff. And then they're coming to see you or me because, hey, I got diagnosed with a thyroid disorder. What do I need? What supplement can I take to fix it? And you're like, well, wait a minute. This thyroid disorder is the result of these last 10, 20 years of just dysfunction or dysfunction after dysfunction after dysfunction that was never really fixed. It was like we just kicked the can down the road. And now you're looking at a more of a multi-system disorder, and the thyroid gland is being shut down to just globally reduce metabolism in the body. And you're trying to put more hormone into a system that's already doesn't want it. And you're wondering why it's not working.
I had a girl that just came to me, a few days ago, and she was like, oh, my T3 levels are just low. I just need to put it on thyroid medication. I'm like, no. Why are your T3 levels low? Let's go back into your history. Let's go back into your symptoms. Remember your gut? There's a lot of conversion that happens in your gut and your liver. So there's different types of people. And I think a lot of your listeners are not those people that are the black or the white, but the most important thing is always understanding the why and understanding that you don't know what you don't know. If you don't check it, you'll never find it. For example, a lot of women, they talk about this in my book too. A lot of women, they don't truly have gut-related symptoms, but they do have gut infections like Candida or H. pylori, or even small intestinal bacterial overgrowth. Sometimes you don't have major symptoms with that. And then of course there's all the nutrient deficiencies that come with that. But you don't know what you don't know. I just want people to really, truly understand that.
Yeah. And typically we have dysfunction before we even have symptoms. But yeah, it's not unusual that somebody will say, I don't really have any GI issues. And one of the reasons might be because they're just used to having GI issues and they don't realize they're abnormal. Like, what do you mean you should 1 to 2 bowel movements per day? Really? I don't want to go like every 3 days, and it's awesome, right? Because I don't have to go to the bathroom much, right? But but sometimes people don't understand that that's abnormal. Or, hey, my cycle's only 2 days. That's great, right? Well, I don't know, right? If your bleeds part of your menstrual cycle is 2 days, I don't know if that's normal, right? We have to take a look at the bigger picture. Or, I only have a cycle every other month. And so it's easy because I don't bleed all the time. It's great, right? I don't know if that's good, right? I think we need to take a deeper look into that. So somebody's been, that's been their norm. So they might consider it is normal. So
periods are very interesting. Women, they look at their periods as a nuisance instead of looking at it as their fifth vital sign, because your period really is your fifth vital sign. It's telling your body, hey, I'm in a safe space or an unsafe space. So that's why we want to utilize our periods and use them as that fifth vital sign, because it tells you if you are in a healthy, safe space.
Yeah. And even your mid-cycle secretions can be a thing that kind of gives you some information as to what's really going on. Now, most people may not, may think it's gross and not want to think about it or talk about it or evaluate it, but that can really tell a story as to what's going on, good or bad, about your physiology.
Yeah.
So what do you think from a women's hormone perspective? What do you see as a major issue? I think we hinted on it already, but what do you see as the major issue impacting women's sex hormone regulation, and how it's treated typically allopathically?
So I did mention I see a lot of low progesterone. But if we're talking the down regulation and suppression of all of our other sex hormones, I see a lot of cortisol dysregulation and a lot of high cortisol. And that high cortisol is then altering the LH and the FSH and then the GnRH pulses that cause us to, of course, ovulate and then produce progesterone. So truly, it's all stemming from our brain, that HPA, that hypothalamic pituitary axis that's communicating down to the rest of our body. So being stressed out, tired and wired, insomnia, trouble sleeping, just getting through our days. I previously said that boss bitch mode, that cortisol dysregulation, and being in that fight or flight, that sympathetic nervous system, whereas parasympathetic is rest and digest, being in that high cortisol state is where I truly see a lot of issues stem. And then you go from high cortisol over time all the way into low cortisol. And that's when shit just hits the fan. And we're talking chronic fatigue, weight gain, joint and muscle aches, blood sugar imbalances, insulin dysregulation, you name it. So cortisol, I think, is where a lot of the issues lie and start.
So a lot of people would say, listen, Lacey, I'm not stressed out, right? And you might look at, let's say we look at a Dutch test and we see that there is high cortisol, low cortisol, high free cortisol, abnormal rhythm, loss of cortisol awakening response. People are just doing what they're doing in their life. And so they don't necessarily feel always like they're overly stressed, especially if you're a mom, you've got a job, you've got kids to take care of, you've got you're in the PTA and you're helping with a sports league or whatever, running your kids to music lessons, right? That's just being a female. So how do you help people understand that they might be stressed out? A, right? What tools could they use to help determine if they're stressed? And two, when we talk about stress, we're always talking about, I think people are always thinking about emotionally, like what kind of gives some idea of the other stressors that when people say, I hate the term stress, right? Because it seems like everybody gravitates to emotions, right? Like the mental piece of it, but stress comes in a lot of different forms. So talk about those two things. Like what would you say are tools that somebody could use without going and getting a Dutch test, or without getting some test done to try and figure it out? What are some tools that they might be able to use to evaluate that they're in stress physiology?
Yeah, the first thing you got to look at is real versus perceived stressors, right? So you don't always realize that a stressor is a true stressor. So that would be a perceived stressor. The first thing that I always tell women is make a chart and put down what adds to your life and what takes away from your life. And that can help you with identifying stressors. Also put down what needs to be done versus what do I want to get done. And that can really help with identifying stressors. And then I'll always like to make women or men, because I work with both, I help them understand that these stressors are not always emotional triggers or physical triggers. They're also environmental triggers, like your endocrine disrupting chemicals, like poor water or air quality, like heavy metals, mold. And then I like to also help them understand that with cortisol dysregulation, there's also internal triggers like trauma that can be always influencing where you are today, and it can hold you truly back. So we want to look at what potential internal and external tigers are causing your body to be in that fight or flight response. And so by using those strategies, figuring out, okay, what is XYZ that could be causing me an issue? And then focusing on what is truly in your control, that could be helpful. And because there's a lot of things that are not in your control. If there's an internal candida infection, that's not currently in your control unless you test. But there are things that you could do, like balancing your blood sugar throughout the day, like focusing on sleep hygiene, limiting blue light, focusing on getting light access in the morning to help with that cortisol awakening response. Even if you haven't tested it, you can get yourself into sunlight as soon as you wake up, or use a happy light. There's little tiny simple things that you could do. I talked about balancing your blood sugar. A lot of women don't do that. They're go, go, go. A lot of the busy moms, they're not even truly sitting down and eating a meal and digesting and chewing their food. So making sure that you have steady, consistent meals, that those meals that you have and those carbohydrates that you have, that they contain a good amount of fiber, protein, or fat to help stabilize your blood sugar. These are easy, simple things that you could do in your day-to-day life to help you. And then there's some great things that I love, like singing, humming, laughing, gargling, things that help with that vagus nerve stimulation to help with cortisol regulation as well, and your digestion. They could be very therapeutic for your body. And then there's some great easy things you could do, like listening to binaural beats, heart math. And I love just gentle massage on your overall body yourself that you could do to really put your body in a safe space.
Yeah, so those are all good strategies. Even the gentle vibration, there's a new unit out, I think called
The
Apollo
Apollo?
Neuro. Yeah.
Yeah.
And so that's a wearable for listeners. It's a relatively new device that's out, but it's a vibrational device that you can wear. And when you're stressed out, you can turn it on, put a program on. You can do it when you wake up in the morning. You can do it before you go to bed at night. But it's based on that principle of putting vibrational impulses in, activates mechanoreceptors, and that can have a calming effect on the physiology. It's why when we get, we kind of like going to getting massages done and physical therapy and chiropractic care, because it's often hands-on touch response, and that has a calming effect on our physiology. But in your client base, like from when we're thinking about a stress response, do you often recommend somebody check their resting heart rate to see where their resting heart rate is, or HRV, or taking blood pressure in multiple positions?
I am a big fan of HRV. So HRV, we want to have that higher in range HRV that tells us we're in that parasympathetic rest and digest place, and having that high that low HRV can tell us that our body's stressed out and that we need extra recovery. So you don't have to have even a wearable to check that. They have those free apps that you can use on your phone. They're kind of weird, but you use your finger to put it up to the camera, and that could be really helpful to assess. And then of course your heart rate in general. If you have a higher heart rate than normal or a lower heart rate than normal, that's a key sign something's going on there.
Yeah, so let's talk about that a little bit. Where would you say the average person, if they're saying, okay, but what should my heart rate be? Like, where would you say for the average person, where would you like to see a healthy heart rate?
Typically a 65 to 85, if you're just resting, would be a more type of normal. Some people get down to like the 55s, but if you're dropping down past 50, I'm concerned. And then of course, never want it above like 100 just sitting there.
Yeah. So if you're an elite athlete, that's different, right? So if you're working, you may have a lower heart rate, but for the average person, I'd say I'd agree. Somewhere in that kind of 60-ish kind of range is probably appropriate. Now, how does that heart rate variability, can you explain that? How does that differ from heart rate? Because I think people get that confused, like what that really means and whether it should be high or low.
So our heart rate variability is like the variations and how our heart is beating on a rhythm basis. So it's telling us the variability in those different heartbeats and the difference between that timeline. So by assessing that, that tells us just kind of like just our body's resiliency to the stressors being thrown at us.
Yeah. So if we think, for the listeners, if we think about heart rate, right, your resting heart rate, and you say, okay, it's 60 beats per minute, then you're thinking, okay, I get a heartbeat every second, right? Every second I get a heartbeat, and then, so I get 60. So that means my heart is beating every second. In reality, that would be a low HRV, correct? Because there's very little variability in the heart rate, right?
Right.
So what we really want to see is you have a heartbeat, and then a half a second later, you have a heartbeat, and then a minute, 1.2 seconds later, you have another one. So that there's a lot of variations between the rhythm and the beat, so that it's not like every second. So the more variability there is, the more metabolically flexible you are. When it's really rigid, that's usually associated with a higher sympathetic state, lower parasympathetic state. And so we can use, if your HRV, and we don't really compare person to person, but it's better to compare a person to themselves. But on average, if you're getting you're looking at your HRV and you're down in the teens, that's probably not very good. The higher that number, the more recovered you are from day to day, the more metabolically flexible you are, the more adaptable you will be to more stress. And the lower it is, the more sympathetic dominant you are, the less adaptable to stress, and the more likely you've got more of your fight or flight hormones kind of pouring out into the system. Is that, would you agree with that?
Yeah, if you think about it, like if you're sitting there and Karen from work is pissing you off, you want your heart rate to start going up because that's telling your body, okay, there's a stressor here. I need to run away from this tiger. And if your body's not ready for that, you're not going to have that heart rate variability. It's not going to speed up. That's not good, right? You want your body to recognize those stressors.
Right. You want it to be able to go up, go up, come down. and be flexible to the situation. And when it's low, it's typically really rigid, not much adaptability. So that's a tool, right? You could look at, how about like just blood pressure? Do you often have people look at their blood pressure when you're trying to find out if they have maybe some adrenal cortisol issues going on?
I don't typically have them test blood pressure. We go based off of symptoms of low blood pressure, like orthostatic hypotension, dizziness upon standing, faintedness, little clamminess. Typically, I only see that in a low cortisol type of state. And most of the time, people are dehydrated when that happens.
So I usually will tell people who have those things, I want them to be aware. So I'll have them, if they have a blood pressure cuff, I'll have them do first thing in the morning, test their blood pressure before they sit up, put your blood pressure cuff on, test it. Then I want you to stand up, test that blood pressure right away. And what I want them to be aware of is their blood pressure should rise. If physiology is working good, their blood pressure should rise as they stand up. And what you see as a lot of people, especially those that we classify as orthostatic hypotension, as their blood pressure drops when they go up, which means they're not getting their physiology isn't working good enough to create vasoconstriction, get blood flow and oxygen to their brain quickly enough. And so we get that dizziness and lightheadedness. So great. So we talk about, from a cortisol perspective, a big deal. How about testing cortisol? Like oftentimes people they'll go to their primary care physician and maybe somebody's testing their cortisol, and they'll get a blood cortisol done, randomly. Sometimes it's in the morning, sometimes in the afternoon. What do you think is the best way to measure the cortisol, and why might just a random blood cortisol not maybe be the best indicator of whether you have optimal adrenal function?
Yeah. So the first thing is, when we're doing a single blood cortisol, we're taking a single snapshot in time. So that's only telling us where cortisol is at during that specific time. And right then and there, if you're drawing your blood, that's a stressor. So your cortisol might go higher than it normally is. And then of course we have binding proteins with our cortisol that can influence that level. So I always say we want to see the overall picture to see what the entire production looks like. So doing either a 4-point salivary or even a 4-point urinary are my favorite tools and methods.
Yeah. So for the listeners, cortisol has a rhythm, right? There's a lot of hormones in the body have a rhythm. So I think maybe I'll let you do that. To explain to somebody what that cortisol rhythm might look like and why they might need to test it over the period of a full day.
So we mentioned earlier the cortisol awakening response. So cortisol, when we wake up in the morning, our hippocampus and our adrenal glands activate that cortisol awakening response. So cortisol should be highest in the morning. It peaks, rapid spike. That's our cortisol awakening response. Then within 60 minutes, it starts dropping down. And then throughout the rest of the day, it continues to go down. So it should be highest in the morning, lowest in the evening. Cortisol should be the opposite of melatonin, in which melatonin should be highest in the evening. So when we are looking at our cortisol pattern, we want to also assess, where is that moving out throughout the day? Because there can be alterations in which some people don't have that cortisol awakening response. It's blunted. There's no response. There's no steady, rapid increase. And that's a problem, especially with combating inflammation, joint pain, muscle aches, mood stability, blood sugar regulation. And a lot of people also can have that tired and wired effect at night. And if you're doing a single snapshot of your cortisol in the morning with blood, or just even a single snapshot for urinary or salivary, and you're not looking at the rest of the pattern throughout the day, you might miss those highs or the lows that play a big role with your symptoms as well.
Yeah. So, and there's a number of tests that are out there, but your conventional allopathic physician's not looking at the rhythm. They're looking at a spot shot. And you can see, I mean, you've seen enough of these, I've seen enough of these, that somebody's, their morning cortisol sample looks fantastic, right? But then you look at a Dutch test and you look at their urine values and you look at their saliva values and you're like, yeah, during that one moment of the day, it's good. But the whole rest of the day, it's abnormal. Your cortisol is way too high at night. Your cortisol is either way too high in the afternoon, which we see a lot, and too low, or too low. And then maybe it's staying too high prior to going to sleep.
And I know too, because when we're looking at that cortisol rhythm, we're not just assessing, okay, where are you with cortisol now? We can also look at, okay, where were you before? Because that adaptation and that cortisol rhythm and pattern shows us, okay, your body has adapted to where it previously was. So you probably already were in that fight or flight, high cortisol, and now your body is adapting and you're trending towards low cortisol. So it really shows people, okay, hey, I got to stop. I've got to change something in my diet, my lifestyle, figure out where these internal or external tigers are.
Yeah. Now, everybody kind of associates the fatigue that they get with, I'm in adrenal fatigue. And there's a lot of controversy as to, is that a real thing, not a real thing? And, but from your perspective, couldn't somebody have chronic fatigue and have high cortisol and have chronic fatigue and low cortisol?
I see it a lot. A lot of people are very, very much confused. Like, oh, I thought I'd have high cortisol when they have low cortisol, or I thought I'd have low cortisol when they had high cortisol. And the body adapts. And the thing is too, your body is adjusting the symptoms based on where you were previously too. So I like to say, focus in on looking at that cortisol as a single snapshot, but also understand those symptoms could be coming from something else. They could be coming from the nutrient deficiencies, the gut infections that have resulted from that cortisol dysregulation. It could be from the alteration in your thyroid hormones that happen due to cortisol dysregulation. So we always want to look at those symptoms, not as just like, okay, this is coming from XYZ because this is what matches my symptoms. It could be a multitude of things.
Yeah, I think people do, what the people do is they listen to a podcast, they listen to a post on a topic like adrenal physiology, and then they assume that the fatigue is caused by their adrenal gland. And I'm like, listen, your fatigue could be caused by 20 things. And it's probably a combination of those things. Because if you have adrenal dysregulation, you're going to have thyroid dysregulation. And if you have adrenal dysregulation and abnormal cortisol physiology, it's usually secondary to something else, right? And we talked about stressors and what could be stressors. Stressors could be food intolerances and chronic inflammation caused by that. And so there could be multiple reasons why we have symptoms. And that's probably one of the biggest differences that should occur in functional medicine to allopathic medicine, is we should be less concerned about managing somebody's or treating somebody's symptoms in functional medicine, and instead look at those symptoms as just information that we can use as a guide to help understand the mechanism of action. But hey, I want you to treat my fatigue. Okay, well, there's probably 30 different things that are causing your fatigue. So why don't we get to the root cause issues, and the fatigue should improve over time. And we'll use your signs and symptoms, your abnormal lab values, as the indicators of how good a job we're doing at achieving the reduction or elimination of those excessive stressors and helping support your physiology back to a more optimal state.
Yeah. And when you get into that cortisol dysregulated state, and especially when you get into that low cortisol state, it's not just cortisol. There's multiple issues. So you have to look and address those. And I know a lot of people, and don't get me wrong, I love the Dutch, but they'll grab a practitioner and they'll be like, hey, let me just do my Dutch test and let me figure out what's going on here and give me XYZ plan based on my Dutch. And that's not going to do anything if you're not looking at everything else.
Yeah. So and that happens a lot of, with almost everything. Somebody comes to see me and says, hey, I want you to tell me what to do with my thyroid physiology. Here's my TSH and my free T4. I'm like, I don't know, because I need to look at your health history, your health timeline. I want to look at a comprehensive blood chemistry panel, because I don't know if the values that I see on the lab are abnormal but appropriate, or normal and inappropriate, right? Because you can have a TSH that's normal, yet have a person with low T4, low T3, tissue hypothyroidism. So it could look normal, but it's totally inappropriate based on the person we're looking at. When you look at the Dutch test, I'm never looking at the Dutch test by itself. I'm always looking at the Dutch test along with their signs and symptoms. I look at the blood chemistry panel with it. And I think that's where we really need to do a better job sometimes in functional medicine, is putting the pieces together and interpreting labs, not just reading them. So I have my Dutch test, right? And I go, okay, this looks like I got compromised phase 1, phase 2 detoxification. Let me go to look at my blood chemistry panel. Do I see confirmation of that? Do I have signs and symptoms that might be confirmation of it? Even within the Dutch test itself, I have compromised, looks like I have compromised phase 1, phase 2 detoxification. And if I go look at my catecholamines, they are normal or low. So they're good, right? Well, maybe no, maybe they're not. The fact that you are anxious and you have normal or low catecholamines should be telling the practitioner that, yeah, this is confirmation that I have compromised detoxification pathways. So instead of those catecholamines, those fight or flight hormones getting metabolized out of the system, they're staying in the system, which is reason why they have anxiousness and anxiety, because they're not clearing them out. So we need to interpret. I've gone over a number of those things, and people have said, hey, yeah, the organic acid part is good. I'm like, no, it's not good. It looks good, but if you look at these other markers, if you have compromised detoxification, how are you going to metabolize your fight or flight hormone? The reason, if I see that an HVA or VMA on their Dutch and it's normal or low normal, and I know the patient has anxiousness and anxiety and more fight or flight type symptomatology, I'm like, that's all. If those are within the normal range or low like that, and you're super chill, that may be normal. Are you super chill? No. Okay, then they're not normal. That confirms that we've got some detoxification issues. And then if we go look at your blood work, we've got confirmation there as well. And so I think we have to sometimes do a better job of interpreting those things, not just saying estrogen's low, let's give more estrogen, cortisol's all over the place, so let's give an adaptogen, right? What's your thought process on that?
Oh, I love that you're mentioning these catecholamines, because the thing that I keep seeing is a lot of different practitioners just throw like mucanaprines or dopamine support. And I'm like, we've got to look at the why behind that. We got to look at the coenzymes and the nutritional factors that are needed to even create these different hormones and to create these catecholamines or create our sex hormones. So for me, I love that you mentioned that, because it's always the why behind the why, and connecting. We're not just treating the test, we're treating the person, their symptoms, their history, and their entire physiology. We're looking at the entire complex organism that they are. I tell people they're beautiful unicorns, right? And we got to find the Cinderella shoe of their healing process and figure out why they are the way that they are, in the words of, The Office.
Mm-hmm. Yeah. And so I think the key is for people is that, especially if they're coming to functional medicine, right? I wish that it was super easy to say, hey, if everybody's a functional medicine practitioner, they're going to interpret labs and lab testing the same way. But it's not necessarily going to happen. And the other thing I think is important to the person who comes here and they hear us, somebody talking about a Dutch test or another hormone test in functional medicine or a GI test, is that oftentimes they'll run out and get that test done, but don't know how to interpret it appropriately themselves. Mm-hmm. And the tests aren't inexpensive. And so I try to get my clients to say, listen, do not run another test without me weighing in on it, because if you spend all kinds of money on tests, but you don't know how to interpret them, it is a waste of time and money. And so it's not as simple as looking for H's and L's on a lab report. It's really more important that somebody who's able to interpret that with your health history, your health timeline, and your medications, your supplements, because those things influence the test, and the rest of your labs. So I think that part's really important.
Yeah. And also, and I hate saying it, but like, don't spend your money on those tests if you're not doing the work that you need to do on diet and lifestyle first. Like and I hate saying, if your diet's crap and you're not balancing your blood sugar and you're not blocking blue light in the evenings and you're not mindfully sitting down, chewing your food, giving yourself time to actually digest your food, don't waste your money on these tests. Focus on what's in your control first. Adjust the diet. I feel like I get on a soapbox, but it's so important, because you could easily, if you do those lifestyle and dietary changes first, if you stop burning your candle at both ends and you learn to say no, you might feel better in a month.
Yeah.
Not always.
Listen,
but make those changes first.
Yeah. I say that always. You don't, there's low-hanging fruit stuff that you can do to change. Yep. Some of it's really obvious. Some of it's super obvious, but we can't see it. Like, try and get good quality sleep, right? So now that's not always easy, but if you're staying up late, getting up extremely early, and you're disrupting that time frame of sleep. What I think the latest research says, hey, we should be shooting for at least 7 hours of just uninterrupted sleep. And most people aren't getting it. I know that was one of the big challenges I had was, sleeps for the week, right? 4 hours of sleep a night. That's all you need. So you can get a lot of work done and be super productive. And that is a major stressor for your physiology. You want to know what stress is? Is it just emotional? No. If you don't sleep on an ongoing basis and get good quality sleep, that is a massive stressor to your physiology. Your body's going to be in a chronic sympathetic cortisol-driven state just to kind of keep going. And that's not a good state. But breathing exercises, nobody likes to do breathing exercises, me included. But how important is breathing to managing a stress response, right? How many people do you see when you look at their labs that you can kind of get a clue that they have a respiratory issue just by looking at their blood chemistry panel, and you go, all right, let's get a controlled hold breath time test, and their ability to, maybe a controlled hold breath time test is maybe 15 seconds, and then they're into panic mode already. You can work on breathing exercises, but it's hard to get people to do those things. Mouth taping at night, so they're not mouth breathing at night, which is a huge issue, especially for those of us who are chronically inflamed. People, it's hard to get people to do these kind of things, but oftentimes they're cheap, easy, and free. And just eating, I think the other thing is people get confused about diet, right? And since you are the dietitian, what's the biggest challenge you see with what's going on especially in healthcare about diet? Like, forget, conventional medicine and what the recommendations have typically been, but even in the functional medicine space about diet, like, what would you say is, because people get confused, right? Should I be paleo? Should I be AIP? Should I be low histamine? What do you tell people they should start? Where's the starting point for the average person if they've got some chronic health issues and they just want to just make some changes? What would you tell somebody?
Yeah, I know it's very confusing with nutrition because we have everybody telling us what we need to do. And our own voice gets lost in the sea of other opinions. And we have to figure out, how does food make me feel? And how can I eat that I feel good with? So to make it as simple as possible, eat less processed packaged foods first. Focus on foods that come from the earth, our fruits, our vegetables, our whole grains. That's a whole different story, but we are lean sources of healthy fats, healthy proteins. Focus on, how can I get more nutrition and more color in my diet? That's the first thing to do. And the issue here in my population is people go into, okay, this is a quote unquote healthy food because it's packaged and it looks healthy and it says low sugar, low fat, low cholesterol. Or they go into I'm not going to touch anything that's been packaged at all whatsoever. And it has to truly come from the ground or the farmer's market, and if it's not, I'm not going to touch it. And it becomes this confusion and then orthorexia, which is basically an eating disorder, truly, of eating healthy food. And it becomes even more confusing for people. So I like to say, you've got to figure out, and you've got to work with a dietitian to figure out what's going to be good for you and your body and your situation, and understand the way that you eat doesn't have to be the way that somebody else eats. If you feel good eating chicken breast and salmon and eggs, and somebody else doesn't feel good that way and they need to eat vegan or vegetarian, that's okay. You have to figure out what's going to be best for you in your scenario and your gut health and your history. And just to oversimplify it, eat an abundant amount of fruits and veggies that you can, as much as you can, without causing yourself digestive issues. Diversify your fats. Stay away from those processed vegetable oils if you can. Focus on those healthier avocado, olive oil, salmon, eggs, coconut oil. Focus on the less processed vegetable oils that you get in those packages. And then diversify your sources of protein. Don't just stick to the animal-based proteins. Play around with the chickpeas, the legumes, the organic tofu products. Diversify your diet as much as possible, because that diet variety is the true king to get as much nutrition as you need.
Yeah, I think that's key for most people, because you start to hear people, they see all these different diets and they're like, well, these people is vegan better? Is paleo better? Is keto better? Listen, they're all dietary strategies, but somebody made all that stuff up. right?
You don't have to have a label on the way that you eat.
Right. And so the biggest problem I think we start to see is all these, everybody wants to protect their food religion, right? Their food diet religion. And so instead of saying, hey, you might do better as a vegetarian or a vegan for a short period of time to make some changes to your gut biome. You might do better for a short period of time as a carnivore person to change your gut biome, or just modifying the diet and getting a lot of diversity to it. But instead, what we've done is we've circled the wagons and shot in. So instead of attacking the processed food industry that is really the root cause of a lot of our health issues, we're attacking the other people recommending whole food, relatively healthy diets. And so for the average person, I think I would agree with you, eat more whole food, right? Less processed food, and don't be dogmatic one way or the other, right? I always say like an 80-20 principle. 80% of the time, eat good, healthy food. The other 20% of the time, enjoy yourself. And when you're enjoying yourself a little bit and you realize that I get gassy and bloated when I do that, take note, and then realize that maybe there's a food sensitivity, maybe there's a food intolerance, maybe there's a mismatch between the food and your gut flora, and maybe keep that food out temporarily and then try and reintroduce it at a later time. But those are things to keep in mind. But if somebody is so strict and concerned and frightened about how every piece of food is going to potentially kill them, that too creates a level of stress that is really unhealthy, right? And can create some problems.
Yeah, 100% agree with that. I've been starting to do these like healthy swaps reels on Instagram, and it really just shows me how people are not educated. They don't understand what's in their foods. And at the same time, they don't understand what true balance is with their foods. Because there is a night and day difference between having a small thing with maybe a little bit of like almond milk, unsweetened almond milk. There's a small amount of people that maybe can't have that at all. And then there's a large population that's not going to have any issue. I could rant for days.
Yeah, I think the challenge is we get too focused on the labeling on the front and not with the stuff on the back, right? And so we see it's gluten-free, it's keto, right? And so we assume it's healthy, right? And that's just great marketing, right? But if I often say, listen, if there's more than 6 ingredients on the back of the package and you don't know what most of those words mean, that's probably a food that you probably don't want to eat very often, right? But just because it says gluten-free on the front or dairy-free or keto does not necessarily mean it's a healthy thing. But I think if we flip that over, look at the sugar load, look at some of the ingredients, you go, when I flip it back over and I see it's keto, yeah, it could be keto, but not healthy, right? It could be gluten-free, but not healthy. If you stick more towards foods the way they came out of nature, you're probably far better off as a good starting point. And then beyond that, if you're doing that and not doing well, that's where it does, I think, really benefit you to then we'll start working with a functional practitioner, because we can do testing to look at a GI tract, to look for leaky gut issues, to look for food intolerances, and help you understand that, hey, it doesn't matter if you love spinach, if you've already lost tolerance to that spinach, you're going to have to give it a break, and you have to take it away for a while because your immune system has identified it as a potential problem. So
I think that's another thing. I'm so glad you brought that up. People eat the same thing over and over and over again, and they don't understand that by doing that, sometimes you can develop intolerances to a food, and you have to take a break for a while.
Yeah, because for the listeners, like we have a GI tract, it's one cell layer thick. It's got little bridges that connect the cells. But if there's a loss of the secretory IgA system, loss of the digestive capacity in the gut, now these food proteins, which should be broken down to peptides, and then peptides broken down into amino acids, it's the amino acids that we should be absorbing across that barrier. But if we have some developing leakiness to the GI tract, now undigested peptides cross that barrier. And when they cross the barrier, the immune system is on the other side of that GI barrier. And it's going, whoa, this shouldn't be here. And it may not create a loss of tolerance to that food the first time or the second time or the third time. But after a period of time, eventually the immune system says that's enough already. Next time that food comes in here and you identify that peptide sequence, we're going to trigger an immune response to deal with it, right? And I tell my clients, like, think of loss of tolerance like people in your life, right? There are people in your life that when they walk into the room, they just light you up and they're great.
Yeah.
There's people in your life that give them or take them. They don't really change your life. You work with them. They're in, they come in and out of your life, and, if they're not there, it's not that big of a deal. If they are there, it's not that big of a deal. But there are people that after a period of time, you can lose any tolerance for. You're just like, as soon as you see them, you're like, oh man, a person just drives me nuts. Get them out of here. Your blood pressure goes up, like you get anxious. And after a period of time with food, if it's not being digested appropriately and it's crossing that barrier, your immune system can say the same thing. This is, enough already. And it now starts to create an immune and antibodies against that food. And it could be the healthiest food, but maybe not for you at this moment in time because of that loss of tolerance.
Mm-hmm.
So
I love the way you worded that.
Well, thank you. I don't know where I got it, but it's, the way sometimes for me, I'm not the smartest tool in the shed. So sometimes I have to keep it simple for myself as well. But I know we're on short time here. So I want you to kind of give us a little bit more information about the book, the name of the book, the title of the book, where people can get the book, where they can find more about Lacey Dunn and what she does.
Awesome. Yeah. Thank you so much. And by the way, you're definitely one of the smartest tools in the shed. So don't discredit yourself, but you can find me. I'm Faith and Fit on Instagram. My book is The Women's Guide to Hormonal Harmony, How to Be the Boss of Your Own Body, Rebalance Your Hormones. I'm really excited because that is available on Amazon. And actually we're coming up on the full year anniversary around May 4th/5th. So you can check that out on Amazon. And then other than Faith and Fit on Instagram, I also have my new company, Nourishwell Nutrition, that I just launched, which is a dietary supplement company that I'm really excited about.
So you're formulating supplements that can help your clients and potentially other people.
I did, yes. I formulated them myself in a third-party UL FDA certified. It's been a whirlwind, but I'm very excited. It's all coming to fruition here.
And there's some people that maybe say, man, is there a possibility that people could work with you from a functional medicine standpoint?
Oh, of course. Yeah. I work with a lot of different women and men. I very much specialize in more of a hypothyroid, PCOS, weight management, gut issue type of state. But I work with many people also that have things like mold toxicities. So, because I've been through that too. So I'm here if anybody needs me. You can go to upliftfitnutrition.com. That would be my website. Or you can always shoot me a DM on Instagram, which is @faithandfit.
And you also have a podcast, right?
I do have a podcast, Uplift Fit Nutrition, which you have, of course, been on. And I absolutely love podcasting, but I give you mad props for continuing them because they're hard to stay on top of.
They are. I'm not the most consistent, but I think I do try and get at least one out in a month, but it's makes it easier when I have great guests to come on like you. So I appreciate you coming on. I give you kudos for the book. It's not an easy thing to get a book out, and people should know that. It's not like you sit down and just write it out in a day or two. It is a process. So I give you a lot of kudos for getting it out. And I know my copy's coming in from Amazon, I really do want to get it at some point. I probably should just mail it to you, and then you can autograph it. So I have the Lacey's energy in the book. And then
it's funny. I call them Laceyisms. If people read through my book, they'll be like, wow, she's really weird. She has really weird, funny, quirky little random things in a random section. So feel free to find them.
Yeah. But I think everybody's got their own little quirkiness. So I don't think you're different than anybody else. So thanks so much for coming on the podcast. It was great having this discussion with you, and I'll look forward to talking to you again soon. All right.
Awesome. Thank you so much.